All right, today we're diving into a really fascinating high-stakes medication called Iloprost. This is a drug that gets called in when the body's own systems are in total crisis, basically forcing open a path for life to go on. Let's get right into it. So I want you to imagine your entire circulatory system as this massive, intricate network of highways. It's constantly moving essential cargo, oxygen, nutrients, to every single part of your body. But what happens if those highways suddenly shut down? Imagine catastrophic, life-threatening traffic jams happening everywhere at once. Well, for people with certain severe conditions, that's not just a thought experiment. It's their reality. Their own blood vessels literally rebel, tightening up, thickening, and launching this dangerous internal blockade that just chokes off vital blood flow. And this slide really shows you just how stark that difference is. On the left, you see a healthy artery. It's wide open, blood is flowing easily, everything's working as it should. But look at the right. In conditions like pulmonary arterial hypertension or severe Raynaud's and scleroderma, those same vessels become narrow and stiff. This puts an unbelievable strain on the heart and literally starves tissues of the oxygen they need to survive. And the human cost of this is just devastating. For someone with pulmonary arterial hypertension, it means their heart has to fight an uphill battle just to pump blood through their lungs, making every single breath a struggle. And for a person with scleroderma, it can cause these agonizing ulcers and bring the very real risk of losing their fingers and toes. The stakes just could not be higher. So, when the body's internal highways are in a state of emergency, what do? Well, you call in a rescue team. And in this story, our hero is a molecule specifically designed to come in and restore order. And that hero's name is Iloprost. Now, what is it? Essentially, it's a man-made version of a substance our bodies already produce, called prostacyclin. You can think of prostacyclin as your body's own natural peacemaker. It's the chemical that tells your blood vessels, hey, relax, open up, and it keeps dangerous blood clots from forming. Iloprost is built to do that exact same job, but on a much, much more powerful level. So, how does it pull this off? Well, Iloprost has two key moves. First, it directly targets the muscles in the artery walls and forces them to relax, which makes the vessels widen. It's like a crew physically prying open a highway that's been squeezed shut. Second, it tells the platelets, those are the little cells responsible for clotting, to just calm down. It puts them in a resting state so they're much less likely to clump together and cause a dangerous blockage. But here's the thing, just having a powerful rescue molecule isn't enough. You have to deploy it with precision. The way Iloprost is actually administered is incredibly important, and it all depends on the specific battle that's being fought inside the body. And this table really lays out the two different strategies. For pulmonary arterial hypertension, the problem is centered in the lungs. So the drug is inhaled using a nebulizer. This delivers a concentrated dose right to the source of the problem. But the effect wears off fast, which means patients have to do this 6 to 9 times every single day. Now, for scleroderma, the problem is systemic. It's all over the body. So the approach is different. Patients get a slow IV infusion, usually in a hospital, that drips the medication in over several hours. You see, this is not a one-size-fits-all kind of medicine. The choice between breathing it in or getting it through an IV is a highly strategic, tactical decision that specialists make to get the biggest benefit with the least amount of collateral damage. And that brings us to the other side of the story. Because a drug this powerful doesn't just work in one place. Its effects ripple throughout the entire body, and that relief comes at a cost. These side effects are basically a direct result of Iloprost doing its job. That feeling of flushing or getting a really intense headache, that's your blood vessels widening all over your body, not just where they're needed. Nausea is also really common. And as you can see, we're not talking about rare events. For a lot of patients, this is just an expected part of the treatment. And here's a really interesting, very specific side effect that perfectly illustrates what's going on. Patients often report pain in their jaw, especially when they're chewing. And you have to ask why. It's because the drug is widening the blood vessels inside their jaw muscles. It's a direct physical sign that the medication is active and doing exactly what it's designed to do. Now, beyond those common issues, doctors also have to keep a close eye on some more serious risks. Because it opens up blood vessels everywhere, it can cause a pretty dangerous drop in blood pressure. And since it tells platelets not to clot, it naturally increases the risk of bleeding. This is exactly why patients are so closely monitored by their medical teams, especially when they're getting those IV infusions. So when you pull all of this together, what's the big picture here? What is Iloprost's role? Well, it becomes clear that this is not some simple fix. It's a demanding, high-stakes lifeline. Let's talk about the real-world challenges for a second. You can only get this from a specialist. It's incredibly expensive and often involves a fight with insurance. And at patient schedule, 6 to 9 inhalations a day is grueling. It takes over your life. Doctors are constantly tinkering with the dose, trying to find that perfect sweet spot where the good outweighs the bad for each individual person. So let's be absolutely clear. Iloprost is not a cure for these terrible diseases. But for patients who are out of other options, for people facing organ failure or the loss of their fingers and toes, it reopens those critical highways. It buys them precious time. It heals painful wounds. It lets them breathe again. It is quite literally a lifeline. And really, the story of Iloprost is this incredible reminder of a core tension in modern medicine. Sometimes the most life-saving, most crucial intervention is also the one that asks the most from everyone involved. It's a difficult road, but for those who need it, it's a road worth taking.